Hello all, today's topic is respiratory failure. Respiratory failure is a condition where there is not enough oxygen or too much carbon dioxide in body. It can happen all at once, acute or common on over time chronic. Many underlying conditions can cause it. Acute respiratory failure is life-threatening condition. Then definition, respiratory failure is a condition where we don't have enough oxygen in the tissues in body, that is hypoxia, or when we have too much carbon dioxide in blood, that is hypercapnia. We might also hear people use term acute hypoxemic respiratory failure to describe it. Then types of respiratory failure. Respiratory failure can come on suddenly, that is acute, or over time chronic. There are two common types, hypoxemic respiratory failure, that is type 1, and hypercapnic respiratory failure, that is type 2. Then preoperative respiratory failure due to shock are the types of respiratory failure. First of all, we can see about hypoxemic respiratory failure. Hypoxemic respiratory failure happens when we don't have enough oxygen in blood, that is hypoxemia. Heart and lung conditions are the most common cause. Hypoxemic respiratory failure is also called hypoxemic respiratory failure. Hypercapnic respiratory failure. Hypercapnic respiratory failure happens when we have too much carbon dioxide, that is CO2, in our blood. If we don't get rid of carbon dioxide, a waste product, there is not a room for blood cells to carry oxygen. The most common cause of hypercapnic respiratory failure include heart, lung, muscle and neurological, that is brain and spinal cord conditions. Certain medications can also cause it. Hypercapnic respiratory failure is also called hypercarbic respiratory failure. Then preoperative respiratory failure. Preoperative respiratory failure can happen when we have a surgery. We will use anesthesia that keep asleep. It can keep from breathing properly. Sometimes air sacs in the lungs can collapse and keep oxygen from getting into blood. Then respiratory failure due to shock. Shock is a condition that causes low blood pressure, fluid in lungs, pulmonary edema and other issues that can lead to respiratory failure. Sepsis, cardiac events like heart attack and blood loss can cause shock. Then causes of respiratory failure, COPD, that is chronic obstructive pulmonary disease, pneumonia, ARDS, neuromuscular disorders, chest wall abnormalities. Next we can see about pathophysiology. First, impaired oxygenation, alveolar hypoventilation, then mismatched VQ. Then clinical features. Clinical features include shortness of breath or feeling like we can't get enough oxygen, that is enough air, that is dyspnea, rapid breathing, tachypnea, extreme tiredness, that is fatigue, fast heart rate, feeling like heart's racing or heart palpitations, splitting or coughing, blood or bloody mucus, hemoptysis, excessive sweating, restlessness, pale skin, bluish skin, lips or nails, that is cyanosis, headaches, blurred vision, behavioral changes that not acting like yourself. Then investigation. Investigations include pulse oximetry. A sensor slips over your finger to measure the amount of oxygen in blood. Then arterial blood gas test. A needle is used to take a blood sample from wrist, arm or groin to measure the level of oxygen and carbon dioxide in blood. Lung function test, also called pulmonary function test. Then imaging like X-rays, CT scan to get images of inside of a body. Then electrocardiogram. An ECG tests how well our heart is working. Then Management. Management include mechanical ventilation. Providers use a breathing machines and tubes that goes into airway to move air in and out of your lungs. Then oxygen therapy. ECMO. Providers use a bypass machine to add oxygen to blood and remove carbon dioxide. Fluids, IV fluids can be used. This can improve the blood flow through your body, bring more oxygen to your tissues. Then managing underlying conditions, antibiotics, steroids, bronchodilators. Then management. Non-invasive ventilations are used, mechanical ventilations are used. Complications and prevention, cardiac arrest, organ failure, prevention, early treatment of lung diseases. Thank you.